Right. So we've had a good discussion here, and we've talked about the toric IOLs, and as the panel was saying that the toric IOLs are here to stay. But the first question is why toric IOLs? It is because once you are, and with the awareness around with the patients, and you are doing cataract surgeries, the patient expect a spectacle-free independence from spectacles for distance vision. That's become the norm because quite a few patients do not require them. They go to a particular doctor, they get themselves operated. Once they get themselves operated, they do not require do not require distance glasses. And once you operate upon them, maybe the surgery has become a perfect surgery, what you've done, but the patient is left behind with a particular number. He compares himself to the other practice. So your practice has to be abreast, and you have to start using toric IOLs in your practice. But with a lot of other toric IOLs coming in, and most of the companies making it, even the Indian companies, there are newer options which are available to align them accurately. And why are they there? Because the method of simply ink and mark is good. It is not a bad practice. But there is something better, and I'm here to talk about some of the technologies which are available in the market. I haven't done a very comprehensive sort of a thing because then it, so whatever is popular, I've tried to put it across. Now, I will, so as I said that the marks, and if I show it in this picture here, the marks here are pretty large. So if I compare one end of the mark to the other end, I, I have another 5-7 degrees to play around with. So what is the exact place? I do not know. So this is the big problem what you face with the lenses. There can be a small error. So let's suppose this patient which we're trying to do, and she's very apprehensive getting the metal very close to her eye. So she's blinking all the time. And what we land up with is imperfect marks where the patient is moving all the time. So these are the marks what we got. And this was with one of our, so the surgeon is trying to make them straight. And now he lands up with these smudged marks, which will lead to compromised results. Now, I'll be talking about some technology, some apps which are available, which will take care of your problem of smudge marks, your problem of misalignments. The very first one in which we are using now is on the femtosecond laser. On the femtosecond laser, it's the intrastromal linear alignment marks. The Catalyst has it, it can make the marks onto the cornea. And the latest upgrade is that it is attached to the IOL Master 700 as well as 500, and the data automatically comes onto the femtosecond machine. So they have, the Zeiss and Johnson & Johnson's have had an agreement where the data from the Zeiss IOL Master 700 is incorporated directly onto the Catalyst, and it will take care of the intorsions, extorsions, and so there'll be marks on the cornea. I will just show a picture of that. Then there is the Intelli Access L system, again a femtolaser based. I'll talk about it. The variant guided systems, the Verify, that is the Aura, which came into being, and it is still available in a few places, but very expensive. The Zeiss Cataract Suite, the iSuite Toric Planner, and the Ingenuity, which is gaining popularity now. That's the 3D systems where you have a head-up surgery. So this is one of our patients, and this is the marks. If you can see here, this one as well as this one, these are the two long marks what I'm talking about. These have been made by the Catalyst machine. On the machine, these were done when the data was not available from the IOL Master 700. And as I said, the upgrade has just come in. Our machine has just got upgraded, and I have not been able to record that. But it now comes directly from the IOL Master 700. That's the lens AR system. As I said, the second one is also a femto-guided one. So what the lens AR does, it makes two notches. So if we look at this picture down here, that's the capsule rexis it makes, but it makes two notches here at the level of the capsule. So you know where exactly to implant your lens in. This is a great method, and I would technically prefer it more than the intrastromal marks. I don't have the lens AR, so I do not know the results, but these might be more stable, these might be more permanent, these might be at the level of the lens, almost at the level of the lens where we're implanting it, so I feel they might be better. The other problem with the intrastromal marks can be that if you're making an incision, so like in the last case, if I'll go back, if I had to make my incision here, I might land up opening it up like the RK incisions. So I have to be very careful while I do my the. So if this is not here and it is right here, there's no problem. But if it is on 180, I would be very careful with this. Plus, if you look at this is supposed to be at 180. This mark is at 180. A line coming here and a line coming here. This is totally off mark. So as I said, that these methods can actually increase your predictability. The next is the Hagstride toric planner. It is available in India now. The lens star has a T cone over it now, and with this T cone, which is right here, so it has been. They haven't made a noise about it because besides the lens star, the I star 900 has also come up, which is a very very good machine. But the lens star, they put a T cone which comes as a package. So this T cone actually puts a Placido onto the eye and calculates it's a Placido topography which calculates the steeper axis, and it can tell you where exactly to put it. So, so you can actually go ahead and plan it with this. There was something which I was playing around with, but as I said that we've got very little experiences with it. It's called the eye photo systems. From the eye photo systems is the Osher toric alignment system. So a high resolution photograph of the dilated pupil is captured during the pre-op examination. There are two unique landmarks on the iris, the crypts or the nevi, which are identified. The keratometric meridians and the IOL is overlaid onto the image, and that's a small video of it. So you go onto the slit lamp Mark II out, put it on the software, and after you put it on the software, you can actually measure the white to white. You can actually say, okay, this is my, you've marked a crypt there. So you go here, you marked a crypt on the iris here, and a second one here, and maybe a third one here. So once you've marked it, the whole eye will be aligned according to that. So once it is aligned, you actually know so the patient in the sitting position, or let's forget about sitting position, we've actually come to know where exactly these are, and whatever the intorsion or extortion takes place, it is not based on the 0, 180, but it is exactly based on the way the crypts are. So it becomes more successful. The variant image guided, which Dr. Punendra did show a few times, it is nothing but a modified keratometer that takes the corneal power measurements, and it automatically detects the scleral vessels at the limbus, which is a HD photograph which it takes. So the modified keratometer, the keratometer readings and the photograph are superimposed onto each other. So this is the reference unit where the keratometry, the white to white, the limbus position, diameter, the corneal reflex positions, the eccentricity of the visual axis, all are taken. A high resolution color pre-op image is taken, which is optimized to the registration and tracking. So that is what is taken, and those are superimposed onto each other. So we've just upgraded our Varian system to the Argos system. So the Varian and the Argos is nothing but the Argos also has a axial length measuring system, a SWEF OCT in it, which measures the. So what the drawback with the Varian was that it had all the formula, it had everything, but you could not measure the axial length with it. So this is the one in the OT, and so there is the MID here, and there is this big screen here. So you actually this is giving you a virtual image in one of your eyepieces. So if you're looking here, this is what we see with both our eyes. This is a virtual image which is on one of the eyes. It actually guides you where exactly to make your incisions, where exactly how big to make your capsular axis so that your IOL is covered all around. So we planned it out as a 5 millimeter. We could plan it 5.2, we could plan it 4.9, whatever we want. So you can actually go around onto this virtual image which you see through your right eyepiece. And then you go ahead and do the surgery in a normal way, what you do. So this is the normal surgery which is being performed, a regular chop, a regular IA. After this is done, you come back and implant the IOL. And as you implant the IOL there, this is an Indian IOL what has been implanted. So you center it, so that's the centering program. So it gives you a centration thing, and then it tells you, so the marks are off almost by 90 degrees, and you moved it, and it is exactly falling there. So that's the end of the video where we're showing that the marks are exactly onto the marks of the IOL. The Callisto eye is a similar principle, and I've also toyed around with that, and we've just got the Callisto in our hospital right now. So it works exactly like the what you call as the Varion, but just that it is working on the IOL Master 700. So that's the advantage what you were getting, which now you get with the Argos as well. So you have to buy one single machine as the IOL Master 700 or 500 now, because they can upgrade a camera to it. So they can attach a camera to the 500. After that, all the readings are taken onto the, you can plan the surgery, and then it goes onto the eye as such, and it's exactly like the Barium. Aura is the optiwave refractive analysis. It is nothing but a wavefront aberrometry online. So you're actually having a constant picture here. When we're seeing this video, it is changing. And as it changes, you can actually, by the end of it, decide what power of IOL, what toricity of the IOL, what axis to implant the IOL in. So this makes it very, very precise, but it was a very expensive tool, and we're getting very good results with the other techniques. So Aura has gone out of vogue now. The Ingenuity is the newest system which has come in, which is a 3D system, and you actually wear Polaroid glasses. And after wearing the Polaroid glasses, you're not looking into the eyepieces of the microscope. Some of the newer Zeiss microscopes even do not have the eyepieces on them. So there is a big screen in front of you. You're wearing Polaroid glasses, and you're looking at the screen and operating. And this also gives you the eye alignment along with that. The True Guide is a touchscreen capability. It's a good system. The Discovery, I'll just go through them because they're not available right now. They are available, but they've not been launched in India. So there's the Discovery system, which again provides the white-to-white, corneal and whole light, provides IOL axis orientation, and it can be, it provides the post-operative astigmatism analysis as well, but it's a very expensive machine, so it is not. The robo marker, which I had used, I bought it on one of the ASCRS meetings. It's a self-leveling corneal marker. That means that it is a marker. If you move it around like that, so there is the dial here, you actually know it is at 0 here. So you don't have to now concentrate on 0, and you just hold it. Even if your hand is going this, it will give a signal that no, you're not at exactly 0 and 180. These are self-inked prongs, and as you put it on the eye, you'll get good results. The Tocular system has come now it is available on the Hagstrite surgical microscopes, and it is just that you have to change one ocular. So this is one ocular which you change, and once you change it, you can actually put in the exact axis where you want to implant it by turning this small knob on the eyepiece. So it's a eyepiece where there is a reticule, and the reticule moves around. There are various others, but just I will just pass through them, and thank you. I'll take questions if there are any. Thank you.
Thank you, Dr. Saurabh, for an exhaustive presentation detailing all the various imaging systems. So are there any questions that you'd like to ask? Anyone? If not, any comments from the panelists?
Any personal experience of Aura or other?
So I didn't have any personal experience with Aura, but that video which I've taken it from RP Center. So I requested Dr. Sudarshan Kokar. They have 2 machines there, and they had been using it very extensively, but it does not work with the OCT on this, because it's on the same microscope. So now they're using a lot of the OCT, so they're not using the Aura anymore. And so it's just like a defunct, and it's a very expensive tool. It's a very expensive tool, but the role of a Aura has gone down quite a bit now. As I said, it is available. There are 2 machines in RP Center.
Intraoperative OCT, they are using more.
Yeah. They're using the intraoperative OCT all the time now, even for the corneal surgeries, even for some of the cataract surgeries. So wherever they're getting an option, they're using the intracamera.
Yes, ma'am.
Okay. There's a question there, yeah. Yeah, here.
Thank you for a very illuminating advancement in technology. I personally use the Callisto system, and I have one problem which I hope the panel can clarify. The main thing about Callisto is that you do the registration, you have everything on the table itself. When you sort of press the button on the foot pedal to see whether you can get the Callisto readings on, and you find that it's not recognizing it. That means the Callisto, for all practical purposes, is not available for you on the actual time when you're doing the surgery. So I have sort of started marking a toric lens in the exact lens where I want it, and then I see whether I get the Callisto when the patient is on the table. What I want to ask the panel is that if you're using Callisto, is that do you have a system where you can in advance know that the Callisto will not register on a particular patient when it's on the table?
So as I said, the IOL Master 700 has a camera. It's a high definition camera which is attached there.
Yes.
You can actually go into the program and look at the picture there, the HD photograph which has been taken by the machine.
Yeah.
If the quality of that picture is good, then it is definite that you will get your registration. It's exactly the same with the Varion as well. So let us suppose, so as I said that we've just got the Callisto, but we've been using the Varion in 3 of our OTs. We've got one unit down there and it is going into 3 of our OTs right now, the Varion. So each time, as busy surgeons, we don't look at our technicians taking the whole, but each time I don't get it, and I have gone back trying to see what went wrong, and it was always the photograph which has been taken is not the best. So the technician error is that he hasn't looked at the data what he's collected from there, the photograph what he's collected from there, and he has already moved the information into the OT, and once you try to register, it doesn't register. So as I said that there is somebody who needs to be keeping a check on that.
But when you're uploading the image onto the Callisto, that means you're on the forum, you're imaging.
Yeah.
Is there any indication that this message, this particular image is not going to register? Is there a readout or a warning that comes up?
So no, there's no warning. There's no warning. You just have to look at the photograph. So that there are times that the lid is slightly drooping down, then the whole topography is not taking, the keratometry doesn't come all right. So it can also lead to other errors along with that. So there are no readings which come up as such.
Yeah, that's my experience
Yeah.
also. That I mean, you may look at a picture and you say, okay, the picture looks fine, and on the table the patient is there, and you're going to put a toric lens, and you're expecting the Z align to come up,
Right.
and it just doesn't move. So I've been forced to sort of do a backup marking myself. And
fine.
it just
That's
it
fine,
sort
I
of defeats the very purpose of getting a Callisto. Is that it's not giving you a red sign or a signal saying that you're going to have problems on the table.
I think you should discuss this with the company because this should not happen. I remember when I bought Varion some 8-10 years back. So during early days, we used to do a backup marking and we used to have this problem with Varion also. But later on, by upgradation, they have now overcome it. And last
So are you saying that you got 100% success rate with
yeah,
Callisto?
yeah.
No,
not with
Varion,
Callisto,
Varion.
So in case you notice, I was showing my Varion that there were marks on that video. It was just because it was in the earlier times. Now the software of the Varion has been upgraded. The chances almost are negligible. I won't say 100%, but there might be maybe in 6 months once you'll have that situation. Maybe I haven't had that. I haven't had that though. As I said, maybe I haven't had that after the upgrade. But before that, before the upgrade which came about 5 years back, we were marking all our cases.
We used to do it earlier. And another thing is that these machines require regular calibration. And these machines, every 2 months, 3 months, the company person comes and do the calibration. That is very, very important.
No,
for the safety of
but
the-
besides the but calibration of this machine, it also has to be calibrated every day in the morning once you
That
set
is-
it.
that
Yeah.
is
So
absolutely
so sometimes the machine pop up says that it needs a calibration, and sometimes it's been 2 months or 61 days since the last
Maybe
calibration.
training of your technician is another
So
thing.
because-
Yeah,
which
I agree. I mean,
These are
the
2-3
technician
things.
is the one who does the
So-
scanning,
so-
and we
Yeah,
upload
so
it.
you need to get back to the company as well. As I said that I have very little experience with the Callisto. We've just got it. I've been using the Varion for the past 6, 7, 8 years, and we had it in 1 OT. We now have it in 3 OTs. Plus, we have only 1 unit, though it is feeding into 3 OTs. So we are very happy with it, especially after the upgrades. And when you say, okay, technology is technology, anything can fail. It's like saying, okay, the phaco machine fails once you're doing a surgery, right? So you can't have a backup. You can still have a backup for a phaco machine, but you can't have a backup for such expensive. But yes, it is.
So I'm very happy with the results I get with the Z Align on a Callisto. When it works brilliantly. I'm happy. But
But,
it's only those frustrating 1 or 2 patients. You think that everything is fine. You get on the table and
I think you need to get the company to come and talk to your technicians and also talk to you, so that you know that okay, once you get into the grind of things, you'll realize that it's more often than not. So as I said that I have hardly had any after the upgrade, but before that there were issues which the company knew about and they've solved it.
Thank
This
you.
should be 0%. And it should be 100% in all the cases. It should come.
But if they're claiming it to be a marker less, so it should come.
Certainly they will
Okay. Thank you very much.